a new patient arrives for surgery at MedAllies Health. The pre-op team is scrubbed in, the operating room is prepped, and the surgeon is ready to begin. But at the front desk, the process stops. The admissions clerk encounters a critical login failure, locking them out of the electronic health record system. Without access, the clerk cannot register the arrival. The patient's digital chart remains unopened and inaccessible to the rest of the facility. This creates an immediate obstacle for the clinical team, who are unable to order the laboratory clearances required before the first incision can be made. In the pharmacy, the impact is just as severe. Pharmacists cannot verify the patient's weight or known allergies, preventing them from dispensing the necessary surgical medications. The delay reaches the administrative wing as well. Without a registered encounter, the system cannot generate the billing codes required to secure coverage from the patient's insurance provider. Because one digital entry point is blocked, every specialized department in the hospital is forced into a holding pattern. While healthcare was once viewed as a collection of independent buildings, modern medicine functions as a highly interdependent data network. The IT support analyst manages the technical infrastructure that allows these clinical connections to function. In a networked environment, a software failure is a clinical bottleneck. This makes technical support a primary factor in maintaining patient safety. To resolve the crisis at MedAllies, we have to map the larger healthcare ecosystem and see exactly where the data flow has been severed. The network begins with providers. This includes hospitals for acute, inpatient care and clinics for long-term outpatient management. When a patient moves from a clinic to a hospital for surgery, their survival often depends on the clinical history stored in their previous records. Laboratories form another critical node. These facilities rely on electronic orders to process and return diagnostic results. If results are delayed or misfiled due to a system error, the medical team loses the data they need to confirm a patient is stable for treatment. The ecosystem also includes payers, the public and private insurers responsible for reimbursing healthcare services. For the hospital to remain operational, a constant stream of clinical and financial data must reach these payers for processing. Regulators oversee the entire network, setting and enforcing the standards for care quality and data privacy. Finally, third-party vendors supply the specialized software, hardware, and medical devices that the other entities use to communicate. Because these different groups often use proprietary software and unique internal processes, there is constant technical friction between them. Standardized data exchange is the only way these distinct organizations can coordinate a single patient's care safely. The ecosystem is built on these interdependencies. Any broken link in the data chain reduces the capability of the entire network. To fix the link, we have to look past the organizations and focus on the specific digital systems that bridge the gaps between them. The electronic health record, or EHR, serves as the central hub of this digital architecture. It centralizes clinical notes and orders while providing decision support, such as automated warnings for medication allergies. The workflow begins with patient registration, which generates the active digital chart required for any other system to interact with that patient's record. Once that record is active, the provider can input specific clinical orders for the surgical team to follow. These orders move to satellite systems like the LIS, the Laboratory Information System, which manages all blood work and pathology data. When the EHR sends an order to the LIS, the lab processes the test and routes the resulting clearances back to the surgeon's view. For imaging, the network uses PACS, Picture Archiving and Communication Systems. PACS is designed to store and transmit high-resolution files, like X-rays and MRIs, ensuring they are attached correctly to the main EHR chart. Simultaneously, the pharmacy receives verified orders through the EHR, matching medications against the patient's recorded weight and history. In a successful loop, specialized data from the LIS, PACS, and pharmacy all converge within the central patient chart. Because this information moves through a sequence of connected systems, the lockout at MedAllies stalled every downstream process in the surgical pipeline. At MedAllies, the surgical team cannot proceed until that data flow is restored. The IT support analyst arrives to diagnose the specific point of failure within the network. They must first determine if the problem is a localized permission error for one user or a systemic crash in the interface queue that moves messages between systems. Every single step of this technical intervention must strictly adhere to HIPAA regulations in order to protect patient privacy. The analyst works to restore access quickly, ensuring that protected health information is never exposed to unauthorized personnel during the troubleshooting process. Recovery begins with a controlled restart of the halted services, which must be done carefully to prevent the corruption of active clinical databases. The analyst then examines the interface queues to locate and release any clinical messages that were trapped in transit during the system downtime. During the verification phase, they confirm that no patient data was lost, overwritten, or duplicated while the system was unresponsive. If a lab result was delayed, the analyst manually verifies that it correctly populates the specific patient's chart once the connection is restored. Resolving the technical lockout restores the clinical workflow, directly returning the hospital to a state of operational safety. Once the analyst clears the access block, the data backlog flushes through the system and the digital chart opens. Surgical clearances appear for the medical team, and the procedure begins exactly as planned. This resolution is made possible by the 4 core pillars of healthcare IT. These pillars define how technology supports the ecosystem. Data storage and data sharing provide the foundation, keeping medical history accessible across providers. Decision support and privacy protection serve as guardrails, reducing errors while securing sensitive data. By managing the flow and security of this information, the IT analyst ensures clinicians have the exact data needed to make informed, life-saving decisions.